So when we plan for focal HIFU therapy, we have to make sure, firstly, that we cover the lesion adequately. And studies have shown that the margin around the tumor needs to be between 3 and sometimes up to 10 millimeters. Smaller lesions tend to need at least 5 millimeters, and larger lesions tend to need more of a margin. In my experience, I found that either a hemi-ablation or a quadrant ablation pretty much covers most lesions. And if you go for a quadrant ablation at least, then you will be able to cover the full margin of that lesion and account for any swelling that occurs. When you've planned for a quadrant or a hemi-ablation, we're looking at a number of things to try and get the dose of HIFU energy right up there where we can ablate the tumor adequately but also safely. So we want to deliver as much energy but without damaging sphincter, without damaging bladder neck, without damaging too much of the neurovascular bundle, and importantly without damaging the periprostatic or the rectal serosa and rectal mucosa. And so there's a number of things that we do to optimize the energy delivery. The first thing we do is to overlay our treatments. So in the past we used to, for a quadrant for instance, do 2 blocks of HIFU energy delivery. Now increasingly for a primary prostate, in other words a prostate that hasn't had previous radiation therapy or previous treatment from HIFU or other ablating modalities, we ablate with 3 zones. So I will often do a middle block which is based on the 4 centimeter focal length, and then I will repeat that middle block again in order to get more energy through. And then lastly I'll end that with a posterior zone, often with a 3 centimeter focal zone, but I won't repeat the posterior again. And what that does is allow us to adjust the treatment for the swelling that occurs. And the swelling does 2 things. One is you get intraprostatic swelling of the lesion, and so you start to develop skip lesions. And then the other thing it does is you start to allow the tumor margin to drift away from your treatment volume. And so you need to incorporate your treatment volume and your energy delivery for both of those things. And we think by overlaying, or what's called the double tap, but the overlaying of 3 zones within the lesion as well as its margin, you're getting lots of energy through. And we've shown that your recurrence rates are much lower by overlaying and by delivering more energy. It's important when you do that you make sure you pause and give plenty of time for cooling in between those zones. I tend to wait about 5 minutes between each zone just to allow this near field cooling. And then the other thing I tend to do is allow for pausing every 5 to 10 minutes.